My name is Tim Pickett. I represent Bolus. We are a team of 4 graduate engineering students working with 2 pediatric specialists. We are developing a device that is non-invasive to detect the frequency of reflux. In the U.S., 12% of parents consider their child's excessive regurgitation a problem and seek medical consultation. Most of these parents are told to simply wait it out, as this is a developmental stage. Meanwhile, 3% of these infants will develop GERD and begin to suffer from esophagitis, poor weight gain, and recurrent aspiration pneumonia. The current method to detect the frequency of reflux requires an overnight stay in the hospital in which a nasal gastric tube is inserted. This is invasive and removes the child from their natural environment. It also induces artifacts of reflux and does not predict how a patient will respond to a given therapy. In a recent journal article published in Pediatric Hospital, the author highlighted these failures and saying shortcomings underscore the need for better diagnostic methods and for treatment plans based on objective evidence. When we look at the market size for the pediatric population, we're looking at 2. First, the 12% of concerned parents, and second, premature babies. In the U.S., 12% of live births are premature. 10% of these will develop GERD. These patients require, on average, additional 30 days in the NICU at a cost of $70,000 per case. This is a combined $3.5 billion cost to our healthcare system. If there was a device that was non-invasive that could be used earlier to detect this, where these patients can get the care they need, that would reduce that cost. When we combine these 2 segments, we come up with 24% of all live births in the USA would benefit from this device. Our device is external, non-invasive, and can be performed at home in the comfort where they feel natural. It involves a sensor patch on the back here. Within that sensor, there's an array of ultrasonic transducers that detect the presence of reflux in the esophagus. These transducers are tied to a data recording box that are now integrated with a onesie that the child can wear with comfort. Currently, pediatricians and family practitioners refer their patients that they suspect of GERD to specialists, and it's the specialists that perform this testing to diagnose GERD. Bolus will empower pediatricians and family practitioners to begin this process much earlier. Since it is non-invasive and simple to use, this will improve outcomes and help the patients, their parents, and reduce the cost of GERD to our healthcare system. Thank you very much for watching Team 508's video.